Good morning. Hi, how are you? I need to make sure you can hear me. I need to put anything in the chat wherever you connect with me, LinkedIn, Facebook, or YouTube. Please put something on the chat. Can you hear me? This is the first time for us to be on the live. Any emoji? If you can hear me, I see there is good number in the LinkedIn. Hit any emoji. Put in the chat. Yes. Yeah. Right now, it's there is a slow. There is a slowness. Let's see. Can you hear me? If you hear me, put something in the chat just to make sure you can hear us. My name is Anas, and we're very excited to start today. I can hear you from LinkedIn. Sounds good. Sounds good. I need to know everyone from where you are, which country, which city you are watching us. If you are in the LinkedIn, put it in the LinkedIn. If you are in the YouTube, do it so. And if you are in the Facebook, we will start it soon just to make sure all technical working fine. Emmanuel, RNM, all good. So now, before we get to start, my name is Anas Abedrabo, and I have Ubaid with me today. Before we get into our live today, I would like to put a video for you. This is where we can make sure everyone coming through, and in the same time, we respect who is on the live. And after that, we will kick off our presentation. So here we go. Bear with me. This is the first time I am. Okay, Albeit, so we will get started. We will kick off. It seems there is a little bit delay. So if you hear me right now and you need, you have any question, we will have at the end the Q&A, but feel free to put whatever you want on the chat. I will keep an eye on the chat. So today we will go through our workshop and what you expect. You will expect to have give you an insight about what is the technology gap and what is the market size currently, and you can know your tech pathway and what is the solution we can offer. And we will sneak peek about the community, and we will open the floor for the end for everyone. So let's get started, and I will share my screen. It's shared. So now let's go for the second slide, just to make sure we are all of us on the page, and this is who will get benefit from this workshop. This is mainly intended for any professional in the healthcare in any stage, either you are as a student or if you are 25 years of experience. Also, this is also for anyone looking for a big grade, a skill set, and looking for a bright future in the professionalism, and also anyone have passion about the innovation and the healthcare. Here is the best place. So this is something we would like to to make sure everyone is aware about what we will discuss. We will discuss how we will be in a good setup when it's coming for professional workplace, and this is will not replace any education, any certificate, and we are not certified from any entity to give you a micro certificate or micro credential. So I hope this is clear for you. If this is sounds good for you, I'm happy to having you. If not, still you are free to stay on the line, but to set the expectation. So who I am, my name is Anas Abed Rabu. I came from Jordan, and I moved to Saudi, working there sometimes, and now I am in Canada, Ontario, Niagara Falls. With me today, my friends Obaid. Sorry, before Obaid, let me give more insight who I am and what I'm doing. So today we will discuss a lot of the information, and here I will try to give you more insight who I am and let you know I've been in the same shoe where you are facing right now. If you have any challenge in your career, I was there. And here, just to highlight it from you, when I start to build my portfolio, I start with my nursing background, only nothing more. So I didn't get back for the school to upgrade my skills. That doesn't mean I encourage everyone not to go for the school. This is my story. This is how I start. So as a nurse, I play different roles. So here the roles which I played. I play as a ICU nurse when just as I started. I play a consultant. I lead a team, and also I do career coaching. I came across the project manager role, product manager role, and board of director member. All of those because I have nursing background. Also, that helped me to work in different workplace setup, like startup company, like hospital, private equity, NGO, NBO. All of those help me to work with them, and that give me diverse of experience. Where today we will share some of those with you. Also, I came across different health tech technology for healthcare in different industry within the healthcare. So I have knowledge or experience with the electronic health solution domain, patient safety domain, GRC, governance, risk compliance, and infection control, workforce management, policy management, and the list go on. I was fortunate, and still I'm fortunate enough to have more participated in more than 75 projects and work with the international company, and I been able to work in 3 different continents, and that give me diverse experience to discuss today with you. If you have any question right now, feel free to ask or write it down to the end, because it is very informative session for you. So now I will hand it over for you, Ubaid. Go ahead.
Thank you very much, Anas. I hope you can hear me.
I
Yeah,
can. I can.
great, awesome. Well, look, I'm Abid Chowdhury. I'd like to thank Anas for having me as a guest speaker here, and I've got vast experience in software and product. I've worked in healthcare as well, so I've got numerous experience in healthcare. I currently don't work in healthcare; I work in logistics, but I've had many vast experience working in the product space, and hopefully I can give you a bit more information as to how we can move forward in terms of the roles that are available and how to kind of use your skills and utilize them as well. So I've been a business analyst, I've been a product owner, I'm currently a product manager, And yeah, I think it's interesting to be a part of this community and make sure that growth is done simultaneously and consistently.
Sorry, Obaid, I missed with the slides. So now then
That's all
it's
right, no worries. That's okay. Right, going on to the next slide. So look, the tech gap in healthcare is quite vast. I've had experience in healthcare as well, and even at the time when I was working in healthcare, um, the IT systems are quite outdated and it's quite fragmented as well. So we've also known that there's many articles around as well where 50% of medication errors do happen from systems as well. I've actually seen personal experiences as well. I've gone for personal reasons to the hospital and to healthcare providers, and I've noticed that there has been quite of a discrepancy with medication or data that is quite importantly needed as a report for when an analysis or diagnostics is being done. So it's quite important to make sure that the systems are up to date, but that has a lot of factors involved, right? You need the right personnel, you need the right people, you need the right information. You also need a set of good team members to be able to identify that and acknowledge that as well, and to be able to establish a solution or be able to derive an understanding on how to move forward and get involved with the right stakeholders. So I don't think there's much of that in the healthcare space, and it's quite important to have that because voices need to be heard, and it's quite important that voices are heard accurately, and that information is being conveyed over. Because fundamentally, if those things aren't put together properly and it's not consistent, it can affect patients and it can affect the recipients of the healthcare um, space, if that makes sense. Okay, we'll go on to the next slide, please, Anna. Yep. Right. So this is the market value and the analysis that we've done. So fundamentally, if you look at the far left, you've got by 2025, which is obviously the year we're in at the moment, the healthcare IT market is expected to be at 880 billion US dollars. And if we look now at the far right, the projected market size by 2030 is expected to be 946 billion US dollars, which is quite a big growth, right? So in between obviously the 5 years, you've got just over about 100 billion. And that's quite a lot, right? And if you look now at the middle, which is the expected forecast by 2034, you've got 3,304 billion US dollars. Okay, so that's trying to say that the market space is growing, and we're expecting that to make sure that it's consistently growing. But that being said, it's quite important to understand that that's not just the healthcare in itself, it's around the personnel as well, the people involved within the healthcare industry as well. So we're talking about clinical specialists. We're talking about healthcare IT project managers. We're talking about EHR implementation specialists. We're talking about coordinators, health data analysts, and we're talking about product managers and all that stuff. So it's quite important to understand that while this space grows, the people within it will also be growing as well, and technology will also be growing. Innovations will be, on the rise to make sure that we've got the right technology. AI, there's a huge increase in AI now, and I've seen a few things go around about AI and how important it is, which is true. But AI is as good as we feed it. So we need to be making sure that we've got the right skills and expertise, because AI can't think like a human. Okay, a human needs to provide the information to AI to be able to give the right information and reciprocate the kind of solutions or information that we need accurately. So that's quite important to note down as well. Okay, we'll go on to the next slide, please. Embracing a lifelong learning. So look, global healthcare IT market. So from 2020 to 2030, it's quite important to understand that it's on the rise, right? And you can see that healthcare analytics is increasing. Medical imaging information systems are always increasing as well. If you're reading articles, if you're involved in the healthcare space, it's great information. There's a lot of artifacts going around talking about the technological solutions that are being implemented to make sure that we can have the right information that is given out to the recipients. Medication issues such as making sure that when you're diagnosing a specific medical problem, that there aren't two medications that have adverse drug reactions and all that stuff. The right equipments are being used, so making sure that you're not reusing the same issue post COVID as well. There's a lot of things that we were able to once use twice or more than once, which we're no longer allowed to use in the hospitals and in healthcare spaces. So physical and tangible products as well as systematic products as well is quite important to understand. And understanding that growth towards 2030 is quite important as well, because that information is valid and relevant when it comes to the market growth of what we have in healthcare. Okay. Understanding health tech opportunities. So look, as I've mentioned, by 2030, of course, there's going to be a huge market kind of demand in terms of healthcare in many countries, even the one I reside in at the moment in the United Kingdom. Um, there's quite of a turbulence when it comes to healthcare, but fundamentally, I think it's quite important to understand that as the growth happens, there's going to be many roles available, and we need to have the right people to fit those roles. Because personally, when you go into the hospital yourself, you want to make sure that you're feeling safe as well, right? Not just as a person working there, but as a person that's going to one day perhaps need to go in there for some assistance, right? So you've got things like implementation specialists. Those are the people that will either deliver the product to the actual healthcare industry in terms of the healthcare um, product or service. So either the hospital or the hospice or wherever that the software is relevant for. There'll be the individuals that are going to be implementing it, making sure that it's being used as it should be used. And going back to the foundation of why it was built, to understand that it's solving errors, solving problems, and giving the right solutions for whoever comes in and is the recipient of that product. Project managers, these are the individuals that will be basically making sure that the product is going accurately to according to plan, making sure that the application of the clinical software is being rolled out correctly and the upgrades are happening necessarily, and also user feedback is being understood, and make sure that there's time frames in place to make sure that the development is done accurately. So that's quite important as well. Product managers guiding a product and development, right? So you using your clinical experience as a product manager to make sure that everything you have in terms of building the value proposition, so the value that you feel that the product will provide to the recipients of that product, is accurate, and it's making sure that you're solving the problems, making sure that the market demand is met. So the product manager's job is making sure that whatever is in the market in terms of innovations, AI, for example, is being built in accurately, or new medications that have come out, making sure that we're understanding what those are, making sure that they're built into the database. If there's new equipment that are being used, if we see that there's a new kind of equipment that is giving us a technological advancement in terms of diagnosing a patient with more reactions or any issues that have happened, then being able to make sure that that is implemented correctly, and making sure that there's guides for that, making sure that we're not exceeded the boundaries of what should be done within healthcare as well. So that's what the product manager should also be doing as well, to make sure that they're shaping the features and the functionality and driving their clinical experience to make sure that they are accurately providing the right product for the healthcare space. Okay, next slide. Business analyst again. So just one quick question. So I'm just going to take off the camera because I'm having some network issues, and I'm just going to make sure that it doesn't interfere.
Okay, Obaid.
Great, thank you. Another role, of course, business analyst. I was one before in the healthcare industry, and that is a very vital role, and it's quite important as well. So you're gathering the information that you need in terms of the healthcare market. You're also gathering the requirements. You're analyzing workflows and making improvement opportunities. You're going out there. You're speaking to the healthcare providers. You're talking to the healthcare recipients. You're talking to patients. You're talking to nurses. You're talking to, any one of the main stakeholders within the healthcare space, to make sure that you're understanding what the problem is, and then you would take that problem back, and then you will try to derive a valuable solution to make sure that we're mitigating any issues or problems that may be arising from, the issues that are being faced in the healthcare sector. Customer success, so it's quite important. That is one of the most important, actually, to be fair, because you're making sure that the product meets the real world needs, and obviously that will be handed over by the business analyst with a team of product informationists, such as the product managers and project managers. But customer success is quite important because you're making sure that the product is constantly working. So, and also you're making those um, assessments as to how you can improve and gather the feedback and take it constructively as well. And clinical informatics, so of course applying your healthcare knowledge to make sure that the systems are bridging any gaps between the people and technology. So that's quite important to understand as well, because at the moment I feel that in healthcare there is a big gap between people and technology. Either it's because people don't know how to use the technology, or if it's a bit too complicated, or if um, if it just doesn't make sense really, right? So we need to make sure that that information is conveyed accurately to make sure that the people using it are able to use the right tools correctly and efficiently. Okay, next slide. So look, essential skill development. So I think what's the most important is the foundation of clinical expertise. So if you have your clinical background, then that's very important, because again, in the healthcare space, it's never enough to have just clinical information, and it's always best to have clinical information at the same time. So look, being a part of groups and making sure that you're reading artifacts constantly, even from the experience you currently have, it's quite important to understand that using that clinical expertise is quite important, because you can understand what you've done on a day-to-day basis in in a real life actual healthcare space setting, and you're able to kind of utilize that to derive solutions and also answers towards how you can start moving forward. There may be pain points that you've experienced in healthcare, um, and how you feel that you could avoid that, and also feedback from your colleagues as to what you didn't like and how things can get moving better. That's real life practical experience that you currently have, not that everyone would get. Um, so yeah, so not many people get that information or that level of experience. So that nursing or consulting or clinical background that individuals do have is valuable to make sure that it can be translated accurately into going into tech, and making sure that we're providing a good foundation to the healthcare space. The next one is tech literacy. Sorry, and as we just go back, I'm just going through
Sorry.
each line one by one. Yep. So tech literacy is the systems and data. So making sure that you're understanding what systems are in place, and what data is getting pulled in. So as I've just mentioned, there's a list of equipment that hospitals would have, right? They have that in a database. So understanding understanding where that sits is quite important, as well as the medications, as well as the administrators understanding who are the patients involved in the wards, and what are the services that they're providing, where are the reports coming from, for the GPs, for the doctors, and all that stuff. So it's quite informative and important really, to make sure that that information is accurately conveyed in systems, as well as the data that is being output. Business acumen, market and operations. So making sure that you've got the right mentality to make sure that the operations are going smoothly. And fourth one is project management, understanding the agile and traditional methodologies of how to move forward. I've noticed a lot of healthcare spaces try to be agile, but they're not successful in doing that. They're mainly waterfall, and the reason why is because they have timeframes in place, and timeframes are restrictive. They've also got budgets as well, and that's not really beneficial when it comes to projects. And the reason why is because in healthcare, things change easily and quite quickly as well. Regulations get put into place. Clinical trials are happening, and a lot of things are happening. So you can't really confine it to a specific budget or a time frame, because there's always going to be something that's needed more. So agile is the right practice for that. I'll go into a little bit of detail later on, but agile can come in many branches, and that's quite essential to understand, because that's the sort of methodology you want to go forward with, because it allows you to make changes instantly and also update instantly as well. The next one is communication, so bridging both worlds. So if you've got clinical background, then it's quite it's quite important and also beneficial actually, because you're bridging the gap between the people and the processes, and also the people and the procedures that are put into place. Okay, next slide, please. Gaining hands-on experience. So look, what I would suggest is, if you want to transition to tech, I would say volunteer for tech projects really. So if you're in a company at the moment, look for the implementations team, look for what your organization provides in terms of tech projects, and try to get a bit of hands-on experience from them. See what they do. Subsequently, you can also shadow IT teams. When I was in healthcare, I remember a couple of colleagues did shadow me when I was a business analyst, and then they went on to become business analysts later on in the future as well. So that's very important, because you're shadowing the way they're kind of working on a day-to-day basis. Like, what sort of meetings are they having? What sort of discussions are they having? Who are the stakeholders that they're discussing with? So those are essential aspects to being able to understand what the hands-on experience is and what it can provide for you. Joining communities, so that's quite important as well. So you're participating in technology steering committees and also the groups within your organization. So, you know, these committees can be internal to your company or it can be external as well. So anything that will give you that experience and give you a better understanding around how tech works and how to kind of thrive off of technology as well. Okay, next slide, please. So look, building your network. So there's many groups in LinkedIn actually. I've joined a few myself, but fundamentally connecting with healthcare professionals, participate in discussions about industry trends, and that's what quite important. That's what I mentioned on a previous slide. It's quite important to understand what is going on in the industry, and you know, healthcare is drastically changing in different countries, and you know, in the country I reside in as well. So fundamentally, these are changes that are always innovative as well, and you want to be a part of that innovative change as well, not because you're going to be a recipient of that, but also if you wanted to be a part of that industry as well. So the discussions are quite important as well. The new medications that are coming out, the new sort of equipment, the new sort of systems, the new sort of applications, the new sort of you know, AI informatics that are coming out and all that stuff. So it's quite interesting as well. So just building that network is quite important because not just for career growth, just for personal growth as well, because it's quite important to understand and keep up to date with what's going on in today's society in terms of healthcare. Attend conferences, that's quite important as well. So anytime you see that there's a healthcare conference, you should be the first to go out there and try to understand exactly what that is, what they're trying to deliver, what is the objective, what is their purpose, what is their vision, what are they trying to convey over to the communities, and also the networking opportunities that you can gain from it is very, very you know, valuable. Participating in webinars as well, so like this one as well, you know, just joining and connecting with people like myself and Anas, making sure that you know you're learning from the experts in those fields, people that have had tangible experience, because it's quite important to understand that you can't really read up experience, if that makes sense. You can learn from it, but the experience that can be gained from working in the tech space, working in the healthcare industry is a bit of a value on its own outside of what normal people have, if that makes sense. So learning from people individually and like-minded professionals as well, so your colleagues as well, trying to understand a bit more about the clinical space. And then if you have questions about something else in a bit more extreme detail, then of course you can reach out to other individuals like myself or Anas. Yeah. And then you craft your transition story, right? Firstly, you identify your transferable skills. So if you worked in the clinical space, if you were a nurse, if you worked on a ward, if you worked in, you know, as a receptionist or a GP or something like that, working with those individuals, then it's quite important to understand your clinical skills that are transferable. Once they've been transferred in terms of what you've identified, you can create a success story as what you've achieved in your healthcare industry in the time that you were in healthcare, and you know uh, what you had achieved, what sort of value you provided for the company you worked for, and what value you provided for yourself as well as the people around you. And then you can create your narrative. You can refine it with feedback. You can reach out to individuals that are a bit more you know, robust in terms of giving feedback and understanding how you can develop your story, and then you develop your pitch, and then you craft a unique value that you've derived from identifying your clinical skills and the value you can bring to tech, and also the documentation of the wins that you have achieved and the benefits that you have achieved as well from that. Okay, next slide, please. And then the job strategies obviously would be to make sure that you target organizations with clinical expertise, and you have that information put into your resume, and you're highlighting the relevant clinical experiences, emphasize your transferable skills towards tech and your eagerness and passion to be able to kind of work in those spaces and also deliver those transferable skills, and also be eager about your involvement in tech as well and the passion that you have for it. And then you prepare for your interviews, right? So you make sure that you've got the motivation, you're ready to discuss your perspective and what sort of information you can provide to that company. Okay, I'll hand it over to you now, Anas.
Thank you, Abaid. Well done. You nail it. I like it. Thank you. A lot of the information, and you make it simple for me to to complete and take it from there. So it is my pleasure to continue. So as I mentioned, the value proposition for your skill set and how you can utilize this, and the market, how much is too big of opportunity, and where you can find it. I need to mention this is the reality, but there is 80% of those job market. It's a hidden job market. So basically right now there is expectation, and there is the study, there is a million plus opportunity or job. It is on the market right now, and it's the working with the health tech company, comparing with the healthcare sector. It is the 63 higher satisfaction. That means you will be more satisfied working with that, and also there is an increase on salary comparing with the role, and this is in the average. So it's very, maybe some people they will have something good salary in the healthcare, and if they move for the health tech, they will have lower package there. But overall, if we take it from different role, from different background, most probably health tech company will be pretty good. So here, some of the statistic to represent how is the healthcare profession, they underrepresented. They have underrepresentation in the market. So only 17% of the healthcare worker are asked for their input during technology change. That whether they are in the hospital or if they are working out of the hospital. So like working with the health company or a research company, whatever. And you can see here the number, especially when we get higher in the position, upper and upper, you can see there is a few of the clinical background, they have those on a position. And we need those leadership to have the clinical background to make sure any new technology or innovation they will come or invent, they will come back for us with the benefit for us as an individual and as a community. So this is where we emphasize to make sure to play a good role regardless in your organization, or to step up and go for the real market. So if I give us the title, most probably how it is the market, and I know most of the nurses where they try to find a job out there, they thought if they put remote and search, they will find the job related for the nursing, but it's not the case. So somebody share with us 5 to 6 job title where we can utilize those skill set from our side as a clinical provider, but that doesn't necessarily those only what we have. We have more. So as a overall, we can utilize the knowledge which we have it only your expertise in the clinical workflow. So having a clear understanding for clinical workflow, it is an asset. This is something none of the health tech staff or follow. They are able to know how you work. They need to consult someone in your unit to make sure how it's work. So having those information in your department, in your unit, and know how it's the workflow within the healthcare setup, this is will give you advantage. And also uh, as a healthcare provider, they know patient is centric, so they will make sure any new technology and a new workflow and a new feature, we need to make sure our focus into the patient. So we will not only focus on the company vision or mission or our financial target. We will make sure we deliver something the patient will get benefit. Our adaptability and working in the fast-paced environment like hospital, this is give us advantage to work where there is a challenge in any setup in the profession. And also we can see the overall and the holistic view what's going on in the hospital, and that give us more opportunity to connect different department, different technology together. And that advantage none of non-clinical they have it, and we have it only. Also when we have those data, we came across a lot and huge of data, but sometimes we cannot understand it. We misinterpreted those information. So we need someone can see those information, can read it, and give us what that mean. So okay, I have those data. So I have, this is the length of a stay in the hospital. Is this is good? Or why I need to make sure to connect, for example, length of a stays with the diagnosis. Is there is any correlation between them? This is information we need to have it from the clinical like you. And also the empathy driven, as we mentioned, we need to make sure it is a human centered, patient centric, and also we put ourselves in the patient shoes. And this is where all those role, we need you to have it in the field. None of this will have it for non-clinical. So this is the innovation methodology or innovation model, where give you somehow where there is any change, there is a resistance for that change, and will take time to make this change. You need to make sure you are in the right phase in the right time for your future. So if you find yourself, or you reach for the level on experience, and you want to expand that experience, and but you are afraid to take a new challenge, or to go out of your comfort zone, see here in the blue line, oh, sorry, the yellow line, you will see the market needs. So when the major or early adopter, or and later adopter, they came to the market with this, because it become this is a trend. So the market will be oversaturated, and there is no job opportunity. Like for example, right now the AI, if you don't take this information and you take this the skill set for your own benefit, this is will be hard for you in the future if you decide it, because you start to see everyone have skill set, or have a course, or have micro certificate, micro credential in AI, for example, and you are still, you think after 5 years to start. So with this, it will be too late. That doesn't mean you cannot find a place or room, you can find, but you cannot find something maybe satisfied you if you started from the beginning. So the message here, if you are interesting in your area or in your future, take the movement, keep rolling, don't stop. And what happened here, most of the us, we thought when we start doing or try applying for the job, and we need to move from where we are to go for a new job, we thought we need to focus every time, we need to focus in cover letter, in the resume, and how to present it. And every time I keep hearing from my client as a coach, Anas, how we can improve my resume, and what I need to do, and what the things I need to make sure. This is very important. But in this slide, you can see the time allocated which is required for you to make any movement. The most important things is not to spend time only in the writing your cover letter. The most important thing, as I mentioned, as I started, 80% of the job market, it's hidden job. That means it is not announced. It is built on the referral. So you need to be connected with the decision maker. You need to connect it with the people within the same setup, with the same corporate, with the same team, to know about that. And when you have a good relationship with them, and they know who you are, what is your skill set, what is your potential, they can give you. If you can see the majority of your time, you need to think how to be available, make efficient and effective networking with, not only with your colleague, out of your area. Start to think about the LinkedIn and utilize this LinkedIn. LinkedIn is not a platform to apply for the job. If you have that concept, you are wrong. You need to correct your information and check back again. LinkedIn, it is a professional community where you connect with the other, and you exchange the knowledge and experience together. So if you spend the most of the time there and you build that connection, that means you will be able to right now after that to know what is your job search strategy. So you know who you are, what you want, what is your future, what the skill set is required in the current market, how much you are ready for that, what you need to do. So this is where you can uh, adopt your strategy to make sure it is fit for the market need. So you need to make sure what you offer for the market is something the market they need. So if you have a clinical background, how to utilize this clinical background for the benefit for those company or for any area have non-traditional work. So they will not looking for your skill set, for example, how to dispense the medication or how to insert the cannula. They need to know how those information will help them to innovate and bring something new. So this is where you need to think about the strategy and know what is the market is there. Then after that, start to prepare for the interview and know what is the market trend. And after this, you will spend time to craft and tailor your resume to fit with the job description which has been shared with you. Either it is public or through the referral. So here I will go when with some comparison here, and the aim from this comparison not to give you any advice or any direction. This is just for your information to see. As I am a nurse, I take this role as a registered nurse to compare what is the average salary for registered nurse in Canada, Ontario in the 2020. So the number is almost 75K. 75K, it is the average salary in Ontario. So when we move right now as a 2025, we know everything is costly right now. There is inflation and all of those things around us. It's keeping a skyrocket. So we know this is number is increased, and the average salary right now for the same role it is 83K. So that means there is an increase. So it's look pretty good, but in reality, what's happen the the role, it's assuming you do your role and your job very well probably, and you are outstanding in your role. So the increment you had in your salary, it's calculated about approximately two as average if they consider that. However, the year over year the inflation in Canada, the average of that is 3.3 percentage. That means you need to be high caliber, you need to be outstanding, and you need to do all the work to get only 2%. However, the average of the inflation 3.3. That means year over year you start to take less. So as I mentioned in 2022, sorry, 2020, you started taking 75, and if you want to start today, you will take 83. But in reality, if you want to start today, the fair price or the fair salary for you, it should be 96. 96 is the average that equal 75 in 2020. But if you want to get into the market right now or into the hospital, you will get 83. That means you will take lower than 2022, and the life it's more expensive than 2020 in that time. So quick calculation, it's approximately 7,000 less in your pocket, which something is not good. Another thing to consider. Again, I keep my eye in Canada as because I am in Canada. One of the things, as example, we know nursing is dominant by female, and sometimes pharmacy. It depends where you are in the world. So if we consider the pay for the same role for the same experience, we found there's a gap between male and female 25%. And this is something huge big. So we know there's a lot of advocacy outside. They keep mentioning DEI and diversity and equity. We know all of that. But do you want to spend your time, someone fight for you and stay in your time, and you find someone like you taking higher than you because he have different gender or identify himself as a man. So here where you can see also the gap from the employer overall for the giving the number within the healthcare sectors, and also the discrimination between the gender. If we can dig deep and see more information how we can utilize those information for our leadership. See, this is the slide where I try to highlight it. If I decided to go with the health technology, why? So here, when we things try to allude and give it directly, there is better salary for those roles comparing with the hospital. Also, there's more flexibility. Most of the time, I hear from the nurses or I hear from the pharmacists or anyone working in the hospital, they would like to have a remote job. They get rid from a daily commute and they want to spend more time with their kids. So to have that life work balance, they're looking for more flexibility, and that option is not available in the hospital, but it's pretty good right now, especially after COVID become norm to have. If you don't have remote work, you have hybrid work. So this is something is required. Obaid mentioned the number with the billions on the market, and I said for you it's more than 1 million job posted in the market right now. And also the innovation here, where you can not only think about the to empower your problem solving for the current situation which you have, like what you do in day-to-day role in the hospital, but also think how in the future you can bring something in you and take benefit that and improve the system, so you will be contributed to make a change in the future. Also, healthcare company, or sorry, health tech companies, or overall in the business, they invest on their staff because they need to make sure they are up to market. They can bring something new. They can take the market share and they can compete on into the market. So if their staff is not competent, they will lose. So in order to do that, they invest in their stuff, and this is vary from company to another. But overall, this is the themes. So what if I don't like the health tech and I don't see myself as a tech savvy, but I'm looking to have different role, and I don't know. I keep here. I don't know where I can work if I don't want to work in the hospital. I like my profession. I like to make the change. I want to improve the system. I want to give better quality and treatment for my patient. But I need to change my role, but I don't know where. So here you can see, you can go with the research domain, you can go with the education domain. Also, as we mentioned in one of the slide, the presentation of the clinical and within the leadership, it's very low. You can consider how to be part from this role. Also with the clinical research, you can use that. Informatics, which we since we started, we just focusing on the informatics and innovation, how we take that, and above that we can take it further. And that structure, it is not solid. This is something a picture where you can play this even with your hospital if you are in the big hospital and they have that opportunity to give it for you. So this is where you can think you can utilize that. So a sneak peek about the role which Ubaid mentioned, all of those as an average salary for them, they are higher from the any role. uh, let's say with the RN, which I compare it in the previous slide, they take here more. So most of the time, them they started from 60 to 70 k as an average. So this is the point where you need to think. Still, I'm practicing my role. By the way, that doesn't mean you don't practice. Still, your credential is valid, and you have more flexibility, and you have more money. Don't want this flexibility and this privilege. So if you are interested in that, think what is most appropriate for you and enroll. And here I want to present for you Kayan. Kayan, it is a community where try me and Ubaid and all the SME and professional season to come together and provide something is not there. So we will provide all the support which you require to uh, grow with your career and with your personal life. So this is where you will find the community. All the people in the community, they have the same passion. No, sorry, the same passion like you. They want to grow and they want to see their value in the future, and they are stuck, they don't know where to start. So the best thing here in the can, we will customize your need through different solution. So one of the things, we have a pioneer we have a pioneer opportunity for you to be part of this community and bridging the gap between what you have and what the market is required, and founding you with the proper team based on your needs. Also, if everyone in the community, we will personalize career development for them. We will share it the 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 needs that they have, like professional mapping, or let's say career mapping, so they will know within 3 to 5 years what the milestone they need to do, with the proper guidance from us to build their future. Also, we will give exclusive resources and content to make sure those content will give you the tip and tricks immediately. You don't need to read a book. You can read a book. I don't tell you don't read. I encourage you to read, but sometimes you need something very quick and immediate, and this is where you have those exclusive resources in a brief and visualized manner to help you to do the content which you read, and to help you. Also, you will find those supportive community and networking, that not necessarily all those community, those an instructor or as a professional came for you. All of the community, they will give you the same sense. They are like you can connect with them, build a new relation, build a friendship, and also to find and exchange the knowledge and experience, and to know what is the market. And this is where we started in one of those slide. The majority and the chunk of your time you need to spend it in the networking. And what is the best to make sure all the in the community they have the same passion and the same role like you. And also, we will provide based on your need, one to one or a group to one mentorship and guidance, and to make sure you have clear guidance based on your need. And also that not only as a professional impact you will have it, also as a social, we will have different approach to work with that. So one of the things we think about it, we think to allocate some time, like a clinic for lawyer, to come to consult lawyer if you need anything. This is part from the community. Anyone can have access for that. Also, if you want to connect with the leadership or with the entrepreneurial successor, to sit with them, and you have an idea and you need someone to help you to craft this idea, anything you're looking for, that you will find this is only as a part from our social impact, and make sure we are part from the external community. Can it is a small community for all clinical background professions. They are interesting to upgrade their skills, and they are part from the real community outside. So we have different layer. The first layer is the foundation, and we called it a growth pathway, as I mentioned, and there that. So we will make sure there is a general pathway, and this general pathway, it's also equipped with the personal branding. We keep here personal branding, but what does that mean? Simply, it is your repetition, without any fancy word. It is your repetition. So how you want to make sure what you are doing is reflected right outside, how the other they read your repetition. This is where we work together and make sure your messages, your tone is crystal clear for the external eye, like how you see it in yourself. And this is the things you need to consider right now, with us or without us. This is something very important to think about your future, regardless what is your role. Even if you decide to stay in your position as is and you don't want to change anything, your personal branding, you need to think about it, because in the future this will help you with the retirement. This is will help you to have a freelance courses or project. Also, you will have the consultant and somehow to be part from those project, and I share with you the needs for the skill set which you have it. So in order to be part from this, you need to make sure you are visible. So how you will be visible if you are not in the digital? So when you are in digital, you need to follow the algorithm, you need to follow the buzzword was there, and to be authentic and genuine. So this is where sometimes some people they have the chance to do that. So we will help you to do that. Also, maybe if you have in your target for a certain a certificate, academic certificate or professional certificate or credential, we have team to support you to make sure you can pass this from the first trial. So you need to repeat those process every time. And one of the things, we have a good community to help you if you are pursuing MBA, regardless what is the university. We will help you to secure the admission, and also we help you during your study to make sure there's a support if you required. But we, for sure, we can help you to secure the admission for those university. So uh, uh, here I will start to share with you more pathway. So this is the first one, which we mentioned the foundation. Second one, we have a clinical innovation and specialized care pathway. So still we are in the hospital, but maybe we can think on different approach of from day to day operation you have it. Maybe we can go with the critical care revolution like the awake and walking ICU model. This is the ABCDE bundle. We can help you get you all the information to be up to speed with this and implement it in your hospital if this is something it's interesting in your hospital, or this is a new opportunity you're looking for. That infection control, all of us we know the importance of infection control, and every time somehow we have them in the hospital, but they have a huge responsibility and accountability in the hospital. So if you think you want to be part from this vision, you are there. Telehealth. So to be part from the team who provide remote services for the customer, what is the patient, you can do that within your hospital, and we can help you to make sure you are equipped with those knowledge without getting back for the school taking any academia. That doesn't mean if you want to have those you cannot, you can, but if you want something quickly and to know how professional you want to secure this role, you we will help you. Even though if you have any higher academic education, it's still the experience is required. And what you will take it have it in the school, when you go for the job market, you will find there's a gap. We fill this gap. We are here to fill this gap, regardless you have education or you not have education, because we believe, at least me, I believe the education will give you a huge information theory, but it's very rare to find a way how to implement it into the market. So we will help you to know how to implement it. Second pathway, if you decided, that doesn't mean you need to take all those pathway. You can take one of them if you would like it, or you can take only the foundation for you. So another pathway, we have teams specialized in the mental health and wellness, so they will help you to go with this pathway if you like it. Also, we have team quality and safety management, and this is from most of my experience in the software where I work with the patient safety and quality team. So here we will help you either to be within the health tech space, or to help you to take the micro credentialing from like CBHQ, and to help you to move for this path within the hospital. Also, the pathway number four, the healthcare operation and leadership, how to make sure within the same hospital you become part from the team. They are in the leadership, and they can make the decision, and they are you are closer from the decision maker. We can help you with that, with to think more strategic and to have role with the change management and project management. And Ubaid mentioned the huge responsibility for the project manager, and also we discussed the salary, how much they can take from that. Also, the healthcare technology and innovation, we mentioned this very clearly about different roles, and we will not get deep for that. Some people maybe they want to think how they can take the healthcare innovation and match it with the entrepreneurship pathway, and here we have specific pathway to help you to do that, and we will do it together. So why Kayan, or why I need this community? because we have a methodology, and this is proven methodology we have implemented in the past, and every time it is have high rate of success. So we have a healthcare innovation career accelerator with HICA methodology that we will take you within the milestones and make sure you are ready for those all milestones. As I mentioned, you can start by your self discovery, or we can work with you to know who you are, what is your identity, why you want to move, what is the best area to go, what is your skill set, what is your strength, what is your weakness, where you need to focus. All of those things we can work with you and help you to know, to set your goal, what is the next milestone. So after that, you will set what is your goal. Now you have a clear understanding who you are and where you want to go, and we will help you to find your fit. What is the best job title for you? What is the best pathway you can work for that? And we have on hand the practice and project based learning. So it is not only theories. You will find, you will be engaged with the real project into the market. We will find a way to engage you and to put you with the hub, either through the academics institution or with the business, to make sure what you have learned it's really and have the impact. And this is will be more confidence for you to put it in your resume, and then after that to find a next career for the target which you approach. And down the road we have ongoing support. That doesn't mean if you moved we will stop supporting you. If you need us, we are there. We will help you, we will support you, and still you have access for your network and your colleague within the community. Last not but not least, here I reach, and I thank you for everyone who stay with us, and sorry for me if I'm not engaging very well in the chat, because I'm presenting and there's a little bit delay. So what I try to emphasize for you, we have digital identity and personal branding workshop soon. We will do it, and if you want, please register it. If you have any information and you're interested on which level you want to go through, let me know. We can work with you, and I will open the floor for a Q&A. And I know there is a delay already there, so we will stay here and give it some time. So so and put in the chat. Thank you, and exactly, networking and strong relationship are key. I know how I read resume, so would write mine as I would see to read it. Great. Yes, we can help you, and you can put your fingerprint, and you make sure your message is crystal clear for the employer, and your tone it is professional. Sometimes it's easy for some people because they have that capacity. Some of them because never been in the business setup. So this is our expertise where we help you to match this with you. Alberta nurses are very fortunate to have an incredible collective agreement just being offered. So interesting to know more about that, and thank you for that. We will connect. I will connect with you and know more about this initiative. Starting anywhere with the gratitude and working your way forward. It what character follow, but acknowledge gender. Yes, yes. We see the gap. We see the gap. Canada consider one of the environment where they supportive diversity, and still we have 25%. So that means you have the choice either to keep yourself calm, someone fight on behalf of you, and we don't know when you will take your fair income, or you can make the change by your hand. And we're happy to make this movement together. We have a lot of the initiative, and I would like to work with you if you are interested in that, even if you are not part from the community, but you are looking to make those changes to improve the nursing wage or healthcare profession wage overall, and just the equity and the salary between all the gender, I'm happy to work together. Community grid mapping smart program. Thank you, Anne. Thank you. Looking forward to having you. So I will open the floor. It's as I mentioned, there is a delay. Me and Ubaid, we will stay here looking for any question. You can request to ask by open your mic if you would like, or you can put it on the chat. So this is the first time for us to be live. It seems there is something from the LinkedIn with this delay. It's work good from our side, but I'm not sure how the other platform.
Yeah, I just want to also highlight that if there's any question regarding tech as well, please feel free to answer those questions as well, regarding any roles in tech or what sort of knowledge you need or how you can move forward and advance in the tech aspect. Yeah. So just keep me updated or just let us know in the chat or give us
Yeah,
a
I just want to
question
also
or
highlight that if
unlock,
there's any question
well,
regarding
unmute
tech
yourself,
as
I
well,
mean.
just keep me updated or
Thank you, Ubaid. Try to check if there's anything came through. Thank you. Sorry, I don't know how to pronounce your name, RNMA. Thank you for that. I hope you have a good time in Qatar and lovely weather. It is cold here. I wish come back someday into Qatar. I like Qatar. But we'll give it more 2 3 minutes. If there is no questions, here our contact information. Please connect with us,
Yeah.
and we can come most of the time because it is Saturday, early morning in our time. It is almost 3 in your time, Abed, right? 3
Yeah,
p.m.
that's right. Yeah.
Yeah, it is here almost 11, and it depends. It's some, I think in Alberta, whereas I'm there also, I think it's maybe 8 or 9, so it's too early. So some of them they will come back and see the record. If you see the record and you see something interesting on what we presented, please connect with us. And even if you don't see, please connect with us and let's work together. There's a lot of the opportunity we can work together to change our healthcare system. Okay, Ubaid, it seems there's no question for today for us. Thank you for your time. I appreciate having you, and we learn a lot from you. This is the first time, but will not be the last time. We will connect again, and we will find more valuable from you. I learned from you a lot during my experience, and I appreciate that. And I'm happy having you on our community.
Thank you very much, Anas. Looking forward to meeting
Thank,
with you again.
thank
Yeah.
you. Bye
Take
bye.
care. Bye bye. Bye.